Good afternoon, everyone. Today's session is going to be really helpful and it's led by Dr. Shivakumar Reddy from Apollo Cradle and Children's Hospital. He's going to talk about Cytomegalo virus. So stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Hello, good afternoon, everyone. This is Dr. Shivakumar Reddy, consultant pediatrician and neonatologist at Apollo Cradle, Jubilee Hills branch. Today, as a part of International Prenatal Infection Prevention and Awareness Month, which is this month, this February, we are going to discuss some important and the most useful points which will be beneficial for the pregnant women and expecting mothers. So today I am going to educate you people on the cytomegalo virus. So when it comes to this cytomegalo virus, this is the most common virus. It is present in all the ages, and it depends upon the person to person. It does not show any symptoms, and even we don't know that we have this virus. And when the symptom comes, if we go for any testing or anything, then only we'll get to know that we are having this virus. You don't believe that 1 in 3 children will be having this virus, and all over the world, after the age of 40 years, half of the population are positive for this virus and this cytomegalo virus. So this is not a serious problem, but only in some cases and in some babies it will be causing some of the serious issues and lifelong issues that we are going to discuss today. So when it comes to the structure and other characteristics of this virus, this virus is the herpes virus. It belongs to the herpes virus family, and this virus has a strange character of lifelong latency. So once we are infected with this virus, we will be having this virus for the lifelong, and it will be in the latent phase, and it may reactivate later on whenever required, depending upon the person's immunity and other health condition. So reactivation will be very rare and it happens occasionally. So when it comes to the high risk groups who are more prone and who should be more cautious and more who should take more preventions regarding this virus, they include infants, because this is the most common this is the most common virus in pregnancy, and it transmitted transplacentally. It is the most common transplacental transmission is the most common to the infants, and other infants who are very low birth weight and who are premature, they are also at risk of getting this virus. And in adults who are immunocompromised and who are on any anti-cancer drugs, or who are tested to be positive for HIV. So, and other adults who had recent organ transplants, they are also more prone to get infected with this virus. So, and in pregnant women, this is the most common, and women who are in their first trimester, they are more prone to get infected with this virus. So they should be little cautious, and they should take little more precautions to prevent this virus. So what will be the signs and symptoms of this virus? How should we know that we have this virus and all? So it depends on the age group also. In adults, the symptoms will be like fever, sore throat, and generalized weakness and fatigue. And sometimes there may be gland swelling also. And when it comes to the newborns, there will be rash, or petechiae, and jaundice, and microcephaly, nothing but small head, and hepatosplenomegaly, enlarged liver and spleen. And sometimes the baby may have seizures and retinitis in the eye, and there may be growth restriction also. Babies may have IUGR, intrauterine growth restriction also. So what are the complications? So whenever the baby has this cytomegalovirus, the baby may have hearing loss and developmental and motor delay. And sometimes there may be vision loss also because of the retinitis. And the babies may have retinitis and vision loss, and they may have seizures and microcephaly also. Lifelong baby's head size may be little bit lower on the lower side when compared to the other babies. So when it comes to the transmission, how is this virus transmitted? So this virus is transmitted through body fluids. Almost all the body fluids carry this virus, like saliva, urine, blood, tears, and semen, and especially breast milk. So, and in pregnancy, transmission will be through transplacental transmission. So, spread to the pregnant woman. How does the spread happens to the pregnant women who were not infected with this virus previously? So, the young children less than 5 years of age are common carriers or reservoirs of this virus. They will be having this virus. As I earlier said, one in three child is tested positive with this virus. So they should be little cautious and they should not share food, utensils, and other things with the children. Pregnant women should not share this food, utensils, and other things with the children. They should not have any contact with the saliva and body secretions of the child. So they should wash their hands frequently with the soap and water as soon as they help the child to go to toilet or after changing the diaper of the child. Any child, even if he is tested or not tested, any child, they should be little bit cautious when handling them, especially in the schools and in the nursing homes. We should be little bit cautious. So how is the what are the diagnostic tests, and how we will get to know that we are being positive or we are positive? So testing the newborn and then testing the after 1 year will be different. So for above 1 year, there are cytomegalovirus antibody tests, which are done through ELISA method, IgG and IgM. So once we do the test IgG and IgM in the adults or in the more than 1 year age group. So if only IgG is positive, then there may be infection once sometime in the life. And if the IgG is positive for two times, like within a gap of 1 to 3 months apart, if the sample is positive, then it is the it shows that it is the primary infection or recent infection. If the IgM is positive and if low titers of IgG are positive, it also indicates the primary infection. So to conclude it as the primary infection, we should do two samples at with a gap of 1 to 3 months. So if the first sample is negative and the second sample is positive, it shows that it is the evidence for the recent infection. And in newborns, we can diagnose or we can do PCR of the saliva and urine. Saliva is the most preferred and the best one to diagnose. Saliva will be contaminated with the breast milk also, and breast milk is richest in this cytomegalovirus. So we need to take some precautions while collecting the saliva sample. We should collect the saliva sample from the baby's mouth only after 1 hour of feeding. And the testing should be done within 3 weeks of birth. If we do the testing after 3 weeks of birth, it may show false positive results sometimes. So when it comes to the prevention, we have already discussed, and the laboratory diagnostic tests and all we have discussed. So is there any vaccine for this one? So as of now, there is no vaccine for this cytomegalovirus, and it is still in the research and developing phase. So we may soon hear a good news or hear a good vaccine for this cytomegalovirus. And when it comes to the treatment, so babies who are tested positive for the cytomegalovirus and who have some of the signs and symptoms. So in babies who have this microcephaly, who are IUGR with this positive PCR test and all, we may need to add some antivirals. So we need to add antivirals like vanciclovir, ganciclovir, valganciclovir. So the treatment will be for 6 months. But the thing is, it should be used very cautiously because they have very lot of serious side effects. So if started early, the baby may have less hearing loss. This cytomegalovirus causes the it is the most common cause of the non-genetic sensorineural hearing loss. So once the baby is diagnosed to be positive, so what are the signs of the hearing loss. We need to monitor the baby regularly, and they should have the regular pediatrician checkups. And the baby may have no startle at loud noises, and baby does not turn to the source of the sound after 6 months of age also, and does not even say a single word by 1 year of age. So these are the signs of hearing loss. So once the baby is diagnosed to have this hearing loss and all, we need to start these antivirals as early as possible. So, and when it comes to the services for the hearing loss, and what is the treatment for the hearing loss, we need to start speech therapy and occupational therapy as early as possible. Hearing aids and cochlear implants may also aid and improve hearing in the children. And the treatment is also a multidisciplinary approach. We need to involve ENT specialist, ophthalmologist, and physiotherapist, occupational therapist, and a pediatrician. Uh, and one more main thing is universal screening for the pregnant woman is not recommended. So when it comes to the cytomegalovirus transmission, the main thing is through transplacental transmission and transmission from the children. And the main complications are congenital in this congenital cytomegalovirus are hearing loss. So this is a brief introduction and description about this cytomegalovirus. And as a expecting mother and as a healthcare provider, we need to know some of the important points. So when we are tested positive for the cytomegalovirus, how we should know that the baby has the hearing loss and all. So the hearing loss may be mild to severe form, and it may progress over the 2 years of age. And as soon as you notice some of the signs like baby is not responding to startle and baby is not turning the head even at 6 months of age to loud noises, you need to get evaluated for hearing testing. And baby should say at least a single word like mama, dada by 1 year of age. If the baby doesn't, then you need to get the hearing test and you need to consult the speech therapist and a pediatrician. So other signs are like baby may have prolonged jaundice and a rash over the body, and may have a small head, which we call microcephaly, and baby may have intrauterine growth restriction, enlarged spleen and liver, and baby may also throw seizures, and there may be damaged eye retina, and baby may have speech delay, and baby may not speak clearly, and baby may frequently say and may repeat the may repeat ha ha kind of words, and baby turns up the TV volume also high. So these are the common signs which the parents can notice that they are having the congenital hearing loss. And for healthcare providers, we need to especially monitor this IUGR and preterm babies for the jaundice, and if any petechiae or any rash present, or if any seizures, or if the baby has any hepatosplenomegaly or retinitis, then we need to rule out this cytomegalovirus. So how can we detect this cytomegalovirus? We need to send the baby's saliva and urine. Both the samples should be sent for PCR, polymerase chain reaction, for this cytomegalovirus. We need to send both the samples to reconfirm. Only saliva confirmation is not necessary. We need to reconfirm by doing in the urine also. So once the baby is tested positive, we need to, as early as possible, we need to start the antivirals to reduce the hearing loss. So routine screening of the pregnant women for this IgG and IgM antibodies is not recommended, and it is not a confirmatory. So, and for the pregnant women, what are the precautions and what are the facts they should know is routine testing is not recommended, and saliva, they should not be in touch with the saliva or urine of the children, and because the saliva and the urine has the high amounts of this virus. For example, they should not share the food utensils, cups with the children, other children, and they should wash their hands frequently with the soap and water after helping the children in the taking to the toilet or changing their diaper. And you need to monitor for the rashes, seizures, and any abnormality in the baby, like any abnormal behavior or anything. If any lack of coordination or weakness or hearing loss, you need to monitor and get back to your pediatrician. So, children with the congenital cytomegalovirus should have regular health checkups. Children with the hearing loss should receive services such as speech or occupational therapy. These services help ensure that they develop language, social, and communication skills. So these are the some of the facts and pregnant women should know. And when it comes to the the hearing loss may be irreversible. So we need to detect within 2 years of age, and we need to go for cochlear implant or any other hearing aids, so that they may have proper communication skills and other well-being. So this is a crisp and short description of the cytomegalovirus. Nothing to worry much about the cytomegalovirus. Only the thing is, as prevention is better than cure, the pregnant women should be little bit cautious, and they should handle other children with care, and they should wash their hands frequently with the soap and water. So that's it when it comes to today's topic, cytomegalovirus. And if anyone has any questions, they can ask. Okay, thank you. I think there are no questions, so we'll wind up and we'll close the today's session. Thanks for the opportunity. Take care. Thank you.